Perfect. So 19 years ago, my wife and I were blessed with our second son. And I say blessed because he came under very difficult circumstances. He was born at 28 weeks. He was 678 grams. He had multiple surgeries. He was in the children's hospital under the care of hundreds, maybe even thousands of healthcare workers for about 2 years when he first came home. And during this difficult and blessed time, my wife and I came across a few healthcare providers who stood out in a way that we remember them and what they did even as of today. So, for instance, there was this neonatologist who did his rounds in a very different way. There were about a dozen neonatologists, and the typical way in which rounds are done in a neonatal intensive care unit is, people come, white coats, they crowd around a little, incubator, and they read the chart very quickly, they make some quick decisions, and they move. And as a parent, as a caregiver, you're behind. And you may have a question. The question is always the same, how's my child doing? But you probably don't get a chance to even ask that question. Now, this neonatologist was different. How was he different? When he would come with his team of interns and fellows and residents, they would bring little stools and they would sit down, open their stools and sit down. And you can imagine what that does when doctors sit down. Time seems to slow down. I'm not in a hurry. I'm here. I'm caring for you. And this doctor would often begin by saying, Mr. and Mrs. Singhal, would you please join the circle? So we became part of the circle. And the question always was directed at the parents. The first question was, and how do you think, Mr. and Mrs. Singhal, given this is your child, and you have been watching over him for the past 24 hours, how is your child doing? And I think the quality of care outcomes for our son were fundamentally different by virtue of the fact that we were engaged in these kinds of conversations. So the practice that this neonatologist observed was not the norm. It was deviant from the norm, but it yielded very positive outcomes. In a similar vein, we had a pediatric anesthesiologist who, our son went through multiple surgeries and they were all phenomenal pediatric anesthesiologists, except this one had a different practice. When she came pre-op to see our son, she asked for permission to hold our baby. It's like, you want to hold our baby? Yes. And so she would pick up our son with all the tubes and hold them. And you can imagine a child is very calm when you hold them, as opposed to pinning them down so you could stick a needle or, do whatever procedure you needed to do. So this was deviant. It wasn't the norm. The norm was hold them down. She picked the child up. And as she picked the child up and administered what we often call verbal anesthesia, peekaboo, distracting the child, her assistant would find a spot where the needle at the first go could find the right place. And by the time the child realizes that the needle has gone in, they respond in a certain way, but then they are also in a position to be comforted right away. So that was different. And then I think the beauty of it from the perspective of a caregiver, a parent, is that when a child goes into an operation room, it's one of the most stressful moments of your life. There's always that sort of sinking feeling that he's going to be put to sleep and what's going to happen. So imagine what happens when the pediatric anesthesiologist asks for permission to carry the child to the operation theater. That's not the norm. The norm is to wheel them down. But imagine if she says, may I have your permission to carry your child? And as she's carrying the child to the operation theater, and as you're being comforted, she sort of looks back and she says to you with a nod, he'd be okay. And what does it do to you as a parent when the anesthesiologist who's going to put them under and hopefully bring them out of it tells you that he'd be okay? So these are examples of positively deviant acts, small little things which make a big difference. Quality of care, clinical outcomes, as well as relational, 360-degree, ecological, caregiver, and ambience kinds of outcomes.